Most people over 65 believe that if a doctor prescribed a pill years ago, it must still be protecting them today. They trust that familiar bottle more than their own changing body. But what if one of the most commonly taken pills by older adults is quietly doing the opposite of what they believe? What if the damage doesn't feel dramatic, doesn't hurt at first, and doesn't show up until it's already deep? From the very first moment, there's a mystery here because cardiologists keep seeing the same pattern, yet most seniors are never warned clearly about it. Here's the first clue. In U.S. adults over 70, the average person takes at least 5 prescription medications daily, according to the National Center for Health Statistics. Cardiologists call this polypharmacy, and they don't use that word casually. Something about the interaction between aging hearts and long-term medication use changes the risk. But which pill is the real problem, and why does the danger rise with age instead of decreasing? To understand this, we have to go back much earlier than most people expect. The origins of this issue start in early adulthood. In the 20s and 30s, blood pressure, cholesterol, inflammation, and stress responses begin forming long-term patterns. Cause: early lifestyle stress, diet, and inactivity slowly stiffen blood vessels. Effect: doctors later respond with medication instead of prevention. By the time a pill enters the picture, the underlying process has already been active for decades. In the 40s, changes start quietly. Arteries lose elasticity. The heart muscle thickens slightly. The American Heart Association reports that nearly half of U.S. adults in their 40s already show early cardiovascular risk markers. Cause: the body adapts to chronic pressure and metabolic strain. Effect: medications are introduced to control the numbers, not necessarily to restore function. This is where the story begins to narrow, but the full truth stays hidden. Cause: the body adapts to chronic pressure and metabolic strain. Effect: medications are introduced to control the numbers, not necessarily to restore function. This is where the story begins to narrow, but the full truth stays hidden. A major turning point in aging science came in the late 1990s and early 2000s, when researchers like Dr. Harlan Krumholz at Yale began studying outcomes, not just lab results. They found something unsettling. In older adults, certain widely used pills improved short-term markers but worsened long-term resilience. The heart looked stable on paper, yet patients became weaker, slower, and more fragile. The shift after 70 is what most people ignore. The aging heart processes drugs differently. Liver clearance slows, kidney filtration drops. According to NIH data, drug half-lives can double after age 70. Cause: medications linger longer in the bloodstream. Effect: side effects quietly accumulate: dizziness, fatigue, exercise intolerance. These aren't dismissed as medication effects, they're labeled normal aging. This is where cardiologists start raising red flags, especially around one category of pills commonly taken for years: certain blood pressure and heart rhythm medications when used without reassessment. Studies published in *JAMA* have shown that overly aggressive blood pressure lowering in adults over 75 increases the risk of falls, fainting, and reduced blood flow to vital organs. The pill isn't toxic in the dramatic sense, but in an aging system, the dose and context can quietly become damaging. The breaking point comes suddenly: a fall, a blackout, a hospitalization after minor exertion. Medicare data shows that cardiovascular-related hospital admissions spike sharply after age 75, even among patients who are well controlled on medication. Cause: reduced cardiac output and poor adaptive response. Effect: the heart can't respond to stress when it needs to most. The fallout spreads beyond health. Medical costs rise. Independence shrinks. Driving stops. Confidence fades. Families step in. The pill that once symbolized safety now quietly shapes lifestyle loss. What makes this worse is the failed fixes seniors are encouraged to try. They add another pill to counter side effects. They reduce activity to avoid symptoms. They assume fatigue means they should rest more. Cause: outdated advice that prioritizes symptom suppression. Effect: the heart becomes less capable, not more protected. Across millions of seniors in the United States, the same pattern repeats. Long-term use: no reassessment, declining tolerance, rising risk. American health surveys show that over 60% of adults over 70 have not had a full medication review with a cardiologist in the past 2 years. The danger isn't the pill alone, it's the silence around its changing impact. Now comes the delayed truth. Cardiologists aren't saying stop your medication. They're re-saying this: what helped at 55 may harm at 75 if it's never re-evaluated. Aging changes the rules, and ignoring that reality costs lives quietly, not dramatically. So, what can people over 60 do today? First, request a medication review focused on age-related tolerance, not just target numbers. This single step has been shown to reduce adverse cardiac events by up to 25% in older adults. Second, track functional signs, not just vitals. New fatigue, dizziness, or reduced exercise capacity are signals, not inconveniences. Third, rebuild cardiovascular resilience through safe movement and strength, which improves heart efficiency and reduces reliance on higher doses over time. Here's one clear warning based on evidence. Never assume long-term heart medications are set and forget after 70. That assumption is where risk quietly grows. And here's the open thought to hold on to. If the greatest threat to the aging heart isn't disease, but mismatch, what else are we failing to re-question simply because it's familiar? If this changed how you think about heart health, please like and share it with someone over 65 who trusts their prescriptions without question. And subscribe for the next chapter, because next, we'll reveal the single test cardiologists wish every senior would ask for, but almost none do.